You started a GLP-1 medication to lose weight, but within days, something completely unexpected begins. Your cravings quiet down. You stop obsessing over snacks. Even your energy and focus feel different. And here's the kicker most people don't realize. This isn't just about weight loss. Your body is silently rewiring itself. Recent studies from Harvard Medical School and UC Davis show that GLP-1 medications not only control blood sugar, but also affect your brain, gut, and metabolism, sometimes before you even see the scale move. Patients report feeling mentally sharper, less hungry, and surprisingly energized. In this video, I'll reveal the hidden effects of GLP-1 therapy, some of which doctors rarely warn about, and why this could be a complete metabolic game changer. You'll want to see this to understand exactly what's happening inside your body. GLP-1 medications like Ozempic, Wegovy, and Mounjaro were originally developed to treat type 2 diabetes, not to shrink your waistline. These drugs mimic a natural hormone in your body called GLP-1, which controls insulin and glucagon to stabilize blood sugar. But there's more happening under the surface. Studies from the American Diabetes Association and clinical trials published in the New England Journal of Medicine show that GLP-1 slows gastric emptying and sends powerful satiety signals to the brain. That means you feel full sooner, naturally eat less, and your metabolism begins a subtle reset. Your body isn't just burning fat, it's reprogramming how it handles energy, appetite, and hormones. And this transformation starts internally, long before your scale shows results. By the end of this section, you'll see why your brain is the first organ to notice these changes, and why it sets the stage for even bigger transformations. One of the most fascinating effects reported by patients on GLP-1 therapy is the disappearance of what experts call food noise. That endless mental chatter about what to eat next, the cravings, the urge to snack, the constant calorie calculations, simply fades away. Research from UC Davis and the University of California system shows that GLP-1 signals travel from the gut to the brain, directly influencing regions tied to hunger, reward, and impulse control. Dopamine pathways in particular become less reactive to high-calorie foods, which makes them feel less tempting. Patients often describe it as a mental quieting, where making healthier choices becomes effortless, not because of willpower, but because biology itself is changing. Imagine no more mid-afternoon snack panic, no obsessive thoughts about desserts, and a natural reduction in cravings. But here's the critical question. If your brain is being rewired first, what other hidden transformations are silently happening in your body without you realizing it? Here's something most people don't realize. While you're focusing on pounds lost, your heart might already be getting stronger. Large clinical trials, including studies from Harvard Medical School and published in the New England Journal of Medicine, show that patients on GLP-1 receptor agonists like Ozempic and Mounjaro experience fewer heart attacks, fewer strokes, and lower overall cardiovascular risk, sometimes before significant weight loss even occurs. Imagine this. Your blood pressure slowly drops. Your cholesterol and triglycerides shift toward healthier levels, and markers of inflammation in your blood improve, all quietly in the background. One patient reported feeling more energetic and less fatigued after meals, without even changing their diet. That's your heart being protected while your waistline is changing. Cardiologists are increasingly recommending GLP-1 medications not just for weight loss, but as part of a metabolic and heart protective strategy. So the next time you notice a change on the scale, remember, your body has already started making deeper, life-saving improvements. The effects don't stop at your heart. Your gut, and everything it controls, is quietly being reshaped. GLP-1 medications slow gastric emptying, meaning food stays in your stomach longer. That's why you feel fuller faster and naturally snack less. But the hidden magic? Your gut microbiome starts subtly shifting. Research from UC Davis and other UC system studies shows these changes can improve insulin sensitivity and stabilize blood sugar, giving you steadier energy throughout the day. Patients often notice fewer post-meal crashes, more consistent focus, and a surprising drop in cravings for sweets and junk food. Your metabolism begins prioritizing fat burning while preserving lean muscle, almost automatically. And here's a small secret. These internal changes can actually influence your daily habits. With reduced hunger, many people find themselves choosing healthier meals without thinking about it. It's a silent reset that goes far beyond exercise or dieting. But if you're curious, the next section will reveal the hidden trade-offs no one talks about. Risks that could undo your progress if you aren't careful. GLP-1 medications can feel magical, but there are hidden realities. Rapid weight loss isn't just fat. Some patients lose 15 to 25% of lean muscle mass if they aren't pairing therapy with resistance training and high-quality protein, according to University of California studies. That means your strength, metabolism, and long-term energy could be affected. Gastrointestinal side effects are another consideration. Nausea, occasional vomiting, and diarrhea can occur as your body adjusts to slower gastric emptying. While often temporary, they can disrupt daily life and motivation. And here's the subtle risk. Appetite suppression makes it easy to unintentionally skip essential nutrients. Calcium, vitamin D, B12, and magnesium can drop, subtly affecting bone and metabolic health over time. The takeaway? GLP-1 medications are powerful tools, but they're not magic. Awareness, proper guidance, and a balanced lifestyle including nutrition and exercise are critical. Understanding these trade-offs ensures that your transformation is not just fast, but sustainable, protecting your body from unintended consequences while reaping the benefits. Here's the ultimate question. Are GLP-1 medications a true health breakthrough, or a hidden gamble? The evidence is impressive. Studies from Harvard Medical School, UC Davis, and the American Diabetes Association show that these drugs can lower blood sugar, protect your heart, support liver function, and even rewire brain pathways that control appetite. For millions struggling with weight and metabolic health, this is nothing short of a game changer. But the story isn't one-sided. Muscle loss, nutrient deficiencies, and gastrointestinal side effects are real, documented risks. Some patients see rapid progress, only to discover that without exercise, proper protein, and nutrient-rich meals, their strength and long-term health could suffer. The takeaway? GLP-1 therapy can transform your body and your health, but only if you understand exactly what's happening inside, follow medical guidance, and pair it with the right lifestyle choices. Ignorance isn't just costly, it can undo the very progress you're trying to achieve.